Hi, I'm Dean Sprague, actually the inventor of the Korebalance device. And one of the patents that we have with this, it makes it so usable and so valuable in a rehab and a balance assessment and training regimen, is that we have a center pivot point, and then we have a 360 degrees of rotation and deflection, which we can change the stability, and we do that with an inflatable bladder. So I want to really differentiate between our calibration, how we calibrate the device when it comes from the factory, versus the platform stability or levelness. Because some people will think because my target on the computer there is off, that the device may need calibration, and that's not true. What happens is this bladder has memory. So when an individual steps off the bladder, it's going to stay a little bit off center because of that bladder memory, and that will be reflected on the screen as well. But using a bubble level, I can get on this device, and then I can get the bubble level as close as I can to center, and that's going to keep my target centered. So it doesn't matter once I step off if the target is not centered. What matters is when I get a patient on here, that target is centered, and I use a bubble level when I want to check it. It's not necessary, but then that target is centered as well when the platform is level. The other thing I like to do is, before I even put a patient on here or start the program, is I'll get a patient to get in position on the device, get comfortable, and then I'll go to one of the tests of the balance baseline, and then I'll have the patient get as close as they can, their center of gravity. We're taking 100 samples a second on this, and then I will start the program when the patient is centered on that. But again, even after I'll do a quick 30-second test here, eyes open, static, and here I'm accumulating score in all 4 quadrants. I'm looking at balance over time with a histograph here, and so we're encouraging a patient over 30 seconds to keep that as close as they can in the middle. 100 times a second, we're sampling that center of gravity sway. And we've got another 5 seconds. And then we're going to get that score. And I'm going to say yes, but when I have a patient step off it, right now the patient is perfectly centered. If they step off to the left, there's going to be a little bladder memory that keeps that target off to the left as well. And that's nothing to do with calibration, that just has to do with bladder memory. Everything is working fine.